Dealing with SI joint pain or dysfunction and looking for effective exercises to help reduce the stiffness and discomfort. By the end of this video, you're going to know exactly how to accomplish this. Hey guys, welcome back to my channel. I'm Jessica, a certified athletic therapist with over 10 years of clinical and field experience and a final year osteopathy student, providing the best tips and tools for living a healthy, fit, and pain-free life. So if you're new here, consider subscribing. So in today's video, I want to talk about the most effective exercises to help self-mobilize and release the SI joint. I'm going to show you 4 exercises today that I find that are the most effective to help do this. Because I value your time as well, I do have timestamps in the description below, so you can jump around the video, or if you want to go back and replay certain sections for more information, you can do that as well. Some of you might be asking, what is the SI joint? It stands for sacroiliac joint. It's comprised of your sacrum and 2 iliac bones or iliums. They are very strong and stable joints, and they have very little movement. The SI joints act as a shock absorber. They're very strong and stable joints, and they are surrounded by strong ligaments on the front and the back that create that stability. Sacroiliac joint dysfunctions are improper movements or pain in the area. So having a hypermobility, meaning you've got more movement than you probably should, or a hypomobility where they're not moving. SI joint pain can result in lower back pain, hip or surrounding pelvis region, down into the leg, or inflammation in the SI joint, which is known as sacroiliitis. So symptoms can be pain, weakness, spasms in the glute or piriformis region, feeling stiffness or tightness. You may also feel groin pain based on where the 2 joints they come together. In the front is your pubic symphysis, and that's where you've got a lot of the adductor muscles that attach into that region. So causes of SI joint dysfunctions usually are very traumatic. Like I said, you don't have a lot of movement at these joints. They're very stable. So car accidents, a fall can be either a direct fall on that hip from, say, walking, and then you miss a curb and you slip. That's what we also call down slip sometimes when we find it. So it just jolts down. Can be from sports as well, so direct trauma, again, falls on the bum, repetitive stress, dominant side that you're constantly repeating, putting more strain and stress on that area. Gait issues as well, so if there's a leg length discrepancy or scoliosis, constant shearing of that one side. And another big one that we see often is in pregnancy, because the hormonal changes will create more laxity in the ligaments, and so they will now start to have a bit more hypermobility in the joints, which can create some issues. So today I'm going to show you 4 exercises that will help self-mobilize the SI joint. The first exercise we're going to do is a shotgun technique. It's a muscle energy technique. You will need a ball or a towel for this. Position, you're going to be lying down on your back with your feet close towards your bum, placing the ball or towel between your knees. I'd like you to be shoulder width apart and keeping your upper body nice and relaxed. You're going to squeeze for 5 seconds firmly, hold, and then 5 seconds release. I want you to do this 5 times. This is an isometric contraction of your hip adductors or your groin muscles. Once you've done the 5 repetitions, rest for a minute, and then we'll repeat 2 to 3 times. Then at a 45-degree angle, lifting the hips slightly off the floor, squeeze the ball for another 5 seconds, and release, come back down to the floor, repeat 5 more times. Then we'll do a full bridge where you'll squeeze at the top for 5 seconds, relax for 5 seconds, come back down, and repeat for 5 more times. During this exercise, you may hear an audible pop. It's normal, but it's not necessary in order to know that the exercise has corrected. This muscle energy technique can be used to help relax tight, tense muscles, spasms, or fibrotic changes due to chronic soft tissue problems. So this is the first part of the shotgun technique. Second exercise is a shotgun technique, muscle energy, which we are going to use the hip abductors. So same position as the first one. This time we're gonna need a belt or a strap. I prefer this versus a stretchy TheraBand because we need it to be a firm contraction. You're gonna lie on your back, knees bent, feet flat on the floor, as close to your bum as possible with your feet parallel to your shoulders. You're going to do 5-second isometric contraction where you're pushing out against the strap for 5 seconds and then release for 5 seconds. I want you to do this 5 times, and then you're going to repeat at 45 degrees or a little bit off the floor. 5 seconds for hold, 5 seconds release, and repeat 5 times. Then you're going to do a full bridge and you're going to push as hard as you can apart and for 5 seconds, and then release for 5 seconds, and then repeat 5 times. An isometric contraction of your abductors relaxes and resets the tone in the adductors through reciprocal inhibition, which allows performing a better contraction. The third exercise is a single leg bridge, also using muscle energy. You're going to have your right foot down close to your bum, and then your left hand is going to be placed on your left knee at a 45-degree angle. You're going to lift your hips up towards the ceiling, basically doing a hip extension with your right leg, and then you're pushing against the left knee and doing an isometric contraction with your hip flexors on that side. I want you to hold for 5 seconds, then come back down, rest for 5 seconds, and do that 5 times. Then repeat and do that on the right side. The fourth exercise is a hip flexor pelvic tilt mobilization technique. So I want you to have one leg up. So you're gonna bring your left leg up and be at a 90-degree angle with the floor. And I want you to have your body directly in line with your right leg, so you're vertical, straight up and down. You're going to do a pelvic tilt where you're tucking your tailbone underneath and then reaching up towards the ceiling and then holding for 2 seconds, coming back down. Reset, do this again. Tuck your tailbone underneath, open up that front of that hip, reach up overhead. Do this 10 times on the right side, and then switch and then perform this 10 times on the left. As you go through the exercise and you're reaching up towards the ceiling, make sure to exhale, draw that rib cage down, and then as you come back down, you can inhale and repeat. If your pain starts to increase during the exercises, stop. They should start to subside and improve as you're doing more of the repetitions. So comment below and let me know how these exercises went. I would love to hear about them. So for prevention of these things occurring, one thing, like I mentioned, if it's a repetitive movement or posture, is that you make sure that when, for example, you're sitting, that you're sitting equally on both sit bones. When you're, maybe if you're standing, that you're not standing and leaning all your weight on one side constantly, or doing repetitive motions on one side and not the opposite. Exercises that are helpful is that you really want to focus on strengthening that pelvic girdle. So having strong glutes, strong core, making sure that you're working on stretching those muscles around there as well. If you feel that there's one side that's tighter than the other, making sure that there's symmetry in the pelvis. Proper posture, so having a towel or a bolster, something placed behind your low back, so then also when you are sitting that you have a nice neutral spine and that you're not kind of slouching. Also having good mechanics, so making sure that when you're picking things up too, you're picking equally with both sides, using your legs, you're not using your upper back, or you're not twisting to one side and using one side only. So now you have these exercises to help you self-mobilize the SI joint. I really hope these exercises help you out, and if they do, hit that like button and let me know how they go. I would love to hear about it. Thank you for watching this video today. If you liked this video, hit that like button. And if you haven't subscribed already, I would love for you to subscribe and share this video with your friends and family. Also, if you missed last week's video, I will place the link below, and it'll also be in this video, so you can watch that one if you missed it.